Good morning and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Nancy J. And today we are getting ready for summer travel. I'm sure everyone is eager to get back to normal and plan a beach excursion or maybe a cruise, just anything to get out of the house, right? But what are the new rules? Is it safe? Is it too soon? We've got answers to all your questions ahead. But first, don't forget to hit the share button to let your friends and family know you are watching. We want them to have a fun summer too. Also, throughout the show, we're going to ask you to get involved by answering a few viewer questions. To respond, all you have to do is text AHA Live to 22333. And we're not going to ask for your name or any other information. It's just a fun and easy way to answer. If you don't want to text in, you can also participate by simply dropping your answer in the comments section. So let's get started. I can't wait for this one. And with me this morning is Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. So glad you're with us today, Dr. Sanchez.
So glad to be with you.
Okay, we're going to have we're going to take a little, it's going to be feeling like we're taking time off here because we're going to go on vacation. You're going to help us make those decisions. So let's start with our first viewer response question. What will your summer plans include now that COVID restrictions are easing? A, travel. B, family reunions. C, live music and concerts. D, going to the movies. E, dining somewhere other than my kitchen table. I like that one. Or F, maybe none of the above. Now, while those answers roll in from our viewers, I do have a question for you, Dr. Sanchez. How has the American Heart Association furthered our understanding of coronavirus this past year?
Wow, that's a great question. One, we have been the voice of credible information about COVID-19 and how it might affect persons with underlying cardiovascular diseases and stroke, but also the general public. The American Heart Association is a credible source of information. So people come to us and expect us to have the answers. We've tried to keep up with the science. We've tried to provide good guidance. But in addition to the general public and patients, we've also provided information to clinicians. And we've also invested in research to try to better understand how COVID-19 is affecting and might affect persons with underlying cardiovascular disease and stroke. And lastly, in this time of vaccine, we have been an advocate and a supporter of all persons eligible for COVID-19 vaccines to get in line, roll up their sleeves, and take a shot in the arm.
Well, I love looking at these responses from our viewers, Dr. Sanchez. As you can see, travel and going to the movies are top ranked. Family reunions is way down there. Maybe people are sick of their families. After
I'm not even going to touch that one.
Okay. But those are all pretty good responses, right? So it's really traveling and going to movies. And we're going to be talking about traveling specifically because up next, health in the headlines. Each week, we pick one current headline that ties back to the topic at hand and ask our experts to respond. This week's entry comes to us from Forbes. The title is, "This is how to stay safe when you travel after the pandemic." There you go, Dr. Sanchez. The article talks about traveling with a mixture of vaccinated and then unvaccinated people, like kids. What are your thoughts on this?
So these are not my personal thoughts. I'm reflecting what the CDC is telling us. Let me start with this. If you have gotten vaccine, one of them, and are fully vaccinated, that is 2 weeks after the last shot that you should have gotten, then you are pretty much free to safely not wear a mask in virtually any setting whatsoever. There are some restrictions in public any sort of public transportation, whether that's buses or trains, and I'll just add airplanes as well. The CDC does, and hospitals. But if you're fully vaccinated, you're pretty much good, except in those circumstances. if you're not fully vaccinated, apart from being outside in the wide open and maybe doing some physical activity and being in settings where most everyone else is fully vaccinated, you probably should be wearing a mask to protect yourself and to protect others. And as it relates to vaccinations, at this point in this country, persons 12 years old and older are eligible for vaccine. In other words, children who are 11 years old and younger are not. And mask wearing is still very, very important. I think I would boil things down to this. Keep up with the guidelines from CDC, understand what fully vaccinated means, do the things to protect your children under 12, and grown-ups out there who are not fully vaccinated, please consider getting a vaccine. And if not, please wear a mask to protect yourself and others in settings other than the two I described, being outside in the wide open or in a limited setting where most everyone else, if not everyone else, is fully vaccinated.
Okay, great advice and very good explanation as to why we need to get vaccinated and or wear that mask. So let's get into our main segment with live viewer questions in You Ask, We Answer. And as a reminder today, remember, you can submit your questions in the comments section or submit them to heart.org/housecalls. So let's get to it. Our first question comes to us from Darren in Casper, Wyoming. I'm feeling a bit anxious about taking a trip. Any suggestions to help ease concerns when planning a vacation? Dr. Sanchez, your answer.
Yes, so I already mentioned a few things about if you're fully vaccinated, you have a little bit less to worry about, but I would boil it down to these things. One, know what the CDC, the Centers for Disease Control and Prevention, is saying. Their website has very, very good information for folks who are fully vaccinated for things that you ought to think about when you travel. If you have children under 12, remember that they ought to be wearing masks. Anywhere where they're not just around family members or a small number of families all fully vaccinated. If you're not vaccinated at all, wear a mask. I think it's also critically important to know what's going on where you are going. So if for some reason the city or the state is experiencing a high level of activity, think about what you do or don't want to do. The other is to know what the rules, regulations, and laws are where you are going. And one piece of advice is, vaccinated or not, carry a mask because whether it's a business or a city or that you are going to get on a bus or on a train, there are circumstances where, irrespective of whether you are vaccinated or not, you will need to wear a mask because that's what the rule is. So carry a mask. Know the rules where you're going, and weigh the pros and cons of is it too much? Is it just enough? Or can I live with what I'm being asked to do when I go to that other community?
And it used to be just, is the hotel booked? Right? That used to be the only thing we had to worry about. But I do like the idea of just always have a mask with you. I've seen a lot of masks on sale now. So, there's no reason not to have one, right?
There is no reason, and you can have, the way I do things is I have 5 strategically placed all over the place. I never have to look too hard to find a mask.
Okay, well, Samantha from Erie, Pennsylvania asks, is it safe to travel by air, and what precautions should I take to be sure if I'm flying for vacation? I know we've kind of gone over that, but I think this air travel is really bothersome to a lot of people.
It's bothersome to a lot of people, but people are beginning to get on airplanes. So I think it is safe to travel by air. I think one other place that I didn't mention is not only trains and buses and airplanes, but depots, whether that's an airport or a train station or a bus station. Not even the recommendation. I think the CDC is saying wear a mask. You will find that people are. So traveling by air is safe. Do all the things that you are being asked to do. If you have children under 12, that is 11 or under. Remember that it is important that they wear masks every single place. But travel by air is safe. Know the rules for the plane before you get on it. But more importantly, know the rules where you're going. So I have no doubt I'll be asked questions about international travel. Other countries have different rules. You better know those rules before you try to get on an airplane and do the things you need to do in advance.
What about public, like a car service, Uber, Lyft? You know, should we all wear our masks when we get into a stranger's car?
I think the better part of valor, whether you're fully vaccinated or not, is to wear a mask. And yet, I would say these are places where we can use our judgment. If you feel if you're in the Uber and all the windows are down, then fully vaccinated folks, I would say without question, you can remove your mask. But I do want to say that if you are fully vaccinated and you just feel more comfortable wearing a mask, wear that mask. It's not doing anybody any harm, and if it's making you feel more comfortable, then that's okay. And we all need to understand that some need to wear masks because they're not vaccinated, and some of us need to wear masks because we're just not ready to not wear a mask.
Okay, here's one from Larry in Morgantown, West Virginia. My family would love to travel abroad, but we are unsure if it's safe to travel outside the United States. What are the recommendations for international travel? There you go, Dr. Sanchez.
Well, the recommendations actually vary by country. And as an example, we U.S. residents are being advised not to travel to Japan right now. There's a lot of activity going on. So it comes back to what I said before. Know what's going on where you're going. Know what the rules are in order to get in or out. You may need to be tested in advance. You may be expected to quarantine once you get there. And so know the rules of the countries you're going to. And I would say go to the State Department's website and see if there are any specific advisories regarding travel in general, but specifically around COVID-19 activity and recommendations from the State Department.
Okay, let's get to one more before we take a break. And Tate asks, I like to stay active when I travel, and often that means outdoor hikes, national parks, and more. If my activities are outdoors, do I need to practice any COVID precautions?
I would say that outdoor activities get like not only double thumbs up, they get 4 thumbs up. That's about as safe as you can be no matter what. So outdoors activities, unless you're just in a particularly touristy, popular place where people are on top of one another. And if you are, if you're fully vaccinated, you are as protected as you could possibly be. If you feel more comfortable wearing a mask, do so. If you are a child who's under 12 years old or an adult who's not vaccinated, in those crowded situations, even outdoors, it's a good idea to put a mask on. But if you are outdoors hiking and there's no one but you and a few people that are part of your household, part of your hub, maybe a couple of households, live free as if it was pre-COVID times.
I'm going to give you that thumbs up. 4 or 5. How many thumbs up do we get for this one?
Everyone watching, thumbs up.
Okay. Well, let's take a quick break for another viewer question. So grab your phone and get ready to text in your answer. As a reminder, all you have to do is text AHA Live to 22333 to answer. And if you're already registered, you don't have to do it again. Or if you're joining us from the phone and it's easier, just drop your answer into the comments. So here is our question. This is perfect. How likely are you to travel abroad this summer? A, very likely. B, still deciding. D, not at all likely. Dr. Sanchez, I'm going to put you on the spot. How likely are you to travel abroad this summer?
Our family is very unlikely to travel abroad this summer. So my family is from the Dominican Republic, and we really, really, really wanted to go. I would like to wait a little bit longer until the vaccination rates, which I think is one of the things that you want to look at. What is the vaccination rate in the country you're going to? We have the benefit in the United States of having done a really, really good job of getting people vaccinated. And even though there's not full herd immunity, there is clearly a protective effect that has had. Countries that are not quite caught up or countries that are way behind are places where you really should think twice. And so it didn't seem right for us to go to the Dominican Republic. We were planning a domestic trip, and it turns out that the people that matter to me, my mother, is coming to visit us for a month. So we're just going to stay at home and entertain my mother, who's been sequestered like so many others for 15 months and was looking forward to seeing her family.
Oh, I'm sure. And if you look, you'll see 55% of our viewers say they are still deciding whether to travel abroad this summer. I'm going to be one of those people too. I'm just not sure. I mean, there's so many other places we can go in the States.
Yeah, and again, I think one of my favorite terms, risk management, is really saying weigh the pros and the cons. And I think that we are reasonable people who can make reasonable decisions when we have good information. And so if you know what your vaccine status is, if you know what's going on, where you're going, and in this day and age, it's not as hard as it used to be to find out those sorts of things, you can make an informed decision about what's right for you and for your family.
Of course, we all know that summer means travel, but it also means family gatherings like Father's Day just around the corner. So let's use our time together this year to encourage Dad to pay attention to his health. Watch this. Oh, I like that. Okay, so we see that most people are going to just decide whether or not to travel. But we've got some more viewer questions. Okay, so here's one from Serena in Salem. Serena says, we are planning a summer vacation and no, we'll be staying in hotels. Is it safe? And what can we do to protect ourselves at this time when you're staying in a hotel, Dr. Sanchez?
So hotels are safe. One thing that we've learned is that the primary way that COVID-19 spreads is from person to person through what comes out of our mouth and ends up somewhere else. That's sort of really fancy talk. It's not spread so much by where people touch surfaces. Having said that, washing your hands regularly is always a good thing, and still is a protective thing. So hotels, safe. I think what you want to do is pay attention to what's going on in the hotel. So I'm going to repeat myself. If you are fully vaccinated, then as you ride in an elevator, for example, you don't need to wear your mask. If you feel more comfortable, do so. If you are not fully vaccinated and you're in an elevator with strangers, you should be wearing a mask to protect them, to protect yourself. And the same goes for other parts of the hotel. Weigh the risks. Look at what the crowd density is. How many people are there? Am I going to be on top of folks or not? And then make a decision about whether to wait for the next elevator, do something different. But it's all about continuously weighing the pros and the cons. If you're fully vaccinated, 12 and older, fully vaccinated, it's a green light for almost everything. But if you feel more cautious wearing a mask, go ahead and wear one.
Okay. I like that from you, Dr. Sanchez. So let's see what you can say to Clara from Las Cruces. She wonders, when my family vacation, that means a lot of eating out. Is it safe to eat at restaurants yet?
So I am hesitating because I just find myself repeating myself. I think particularly if you're fully vaccinated, it is safe. Outdoors is safer than indoors, but it is safe. You are as protected as you're going to be. You want to look at what's going on in the restaurant. Are they doing the sorts of things that would suggest to you that they are trying to keep people safe? So staff wearing masks is good practice, because among those who are not wearing masks may be people who are not fully vaccinated. Staff can't know that. If you see that there is less crowding, that's a good sign that they're paying attention. If you see signage that encourages people who are not vaccinated to wear their masks when they're not eating, that is another sign that that's a place that's paying attention to not only what they're serving, but also the safety of the venue. So it's safe. If you're not vaccinated, less safe, because that's going to find you indoors with other people who may or may not be vaccinated.
This is one of those instances, Doctor, when it is good to repeat yourself. So thank you for that. And now, Gladys in Lincoln, Nebraska. Many states seem to be lifting mask wearing requirements in public. So does that mean it is safe to travel and be in public without a mask? Again, you're going to feel like you're repeating yourself, but we need to keep hearing this, Doctor.
Yeah, so what I would say to you is that where mask mandates have been lifted universally, that is absent or separate from the guidance, the science guidance that says if you're fully vaccinated, you are safe not wearing a mask in virtually every circumstance you may find yourself in, except for what local rules, regulations, and laws say, and except for those buses, trains, airplanes, bus depots, and airports. If you are not fully vaccinated, it is a good idea to wear a mask, except in those situations where you are with a small number of people, most or all of whom are fully vaccinated. If you are with your household, or if you are outdoors, where there's not a lot of density, not a lot of people on top of one another. But this just is repetition. Because the law says you don't have to wear a mask, doesn't mean that you shouldn't wear a mask from a health and safety perspective. And let me repeat, for children under 12, mask wearing is important to protect them and important to protect others until vaccine is available for a greater number of children at the ages under 11.
Well, Arthur's got a good question that we haven't touched on yet. Summer means pool time for my family. Is it safe to use public pools this summer when we travel?
So it just comes back to everything that I've said. If you're fully vaccinated, it is probably quite safe to be in public pools. If not fully vaccinated, then wearing a mask is not the best idea inside of a pool. The mask kind of wet. But that's a situation where you got to weigh the pros and the cons. You got to look at the situation and make an assessment. Is there a way, if you have children, to sequester your children in a place where they can play and not be right on top of other kids? Choose your time. We all travel enough to know that there are times a day where there's not a lot of people in a pool, at a hotel, for example, or even a public pool. And there's times a day where there's many more people. Very early in the morning when things start opening, that might be a good time if you feel like it is critically important to be in the pool for my family, and there are some who are not fully vaccinated.
Okay, we've got time for one last question. It's from Stephen, who says, I'm not ready to get vaccinated yet, but I am ready to travel. Can I travel safely without being vaccinated?
You can if you wear a mask. You're always wearing a mask. But what I would say to you is, please talk to your doctor, talk to the pharmacist in your local pharmacy, go to getvaccineanswers.org, because I think that you can be convinced that it would be a really, really good idea to get vaccinated. It protects you. It protects those around you. You don't have to wear a mask. and you can safely do the things that you want to do with others.
Dr. Sanchez, what a great discussion. And thank you so much for being our tour guide, so to speak, today. I mean, the idea of traveling this summer is just so exciting, but also a little scary. So thank you for clearing things up for us because you've made it very simple. Is there anything else you'd like to add before leaving us today?
The 3 W's always work: mask, distance, and washing hands. If you don't wear a mask, you don't have to think about those. If you are vaccinated, you don't need to be wearing a mask. You don't have to think about those. So I would say to you, I'm not your personal doctor. I'm not your pharmacist. I'm not a website, but I would encourage you to go get your vaccine. My mother's fully vaccinated. My mother-in-law's fully vaccinated. They had no symptoms. They can live life the way they were living it before COVID.
Oh, thank you so much again, Dr. Sanchez. You are always a treasure trove of information. And you know what? God, where does the time go? That does it for today's show. It's also my last show for a while. House Calls is taking its own vacation for a few weeks. And when it returns, it's going to look a little different. You're going to meet a new host. And I just have to tell you, I have really enjoyed being with you all. I may get a little verklempt here. The last few months, I have learned so much. I am exercising more. I am monitoring my high blood pressure. I'm using less salt. I've stopped salting things. I know the stroke risks. So I hope that you have learned as much as I did as well. And I have been talking to my family and friends about this, so I hope you will too. House Calls will return Tuesday, June 15th with all new topics. Until then, you can find any of our previous shows at heart.org/housecalls. I do hope your summer is filled with family and love and connection. And I guess if we learned anything today, it is go get vaccinated. And I'm ready to pack up. I need to find my sunglasses. Thanks.
Getting back to this, to her, to family, to friends, to hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.